Enteritis and paratuberculosis in ruminants. Enteritis can be caused by viruses, parasites, bacteria, fungi, and non-infectious causes. The viruses that cause it are bovine viral diarrhea, rotavirus, adenovirus, and coronavirus. The bacteria that cause it are E. coli, Salmonella, Clostridium perfringens, D. Mycobacterium avium, paratuberculosis, Campylobacter, as well as chlamydia. The parasites that cause it are Emeria, Cryptosporidium, Toxicara, and the funguses that cause it are Candida albicans, as well as Stachybotrys and Fusarium. And the non-infectious causes are abnormal ruminal content, chemicals, or rotten or moldy feed, as well as too cold milk replacers which cause putrefaction. For the pathogenesis, enteritis leads to malabsorption and maldigestion, which causes diarrhea. The osmotic effect is when abnormal digestion and secretion leads to hyperosmosis. Inflammation and necrosis can also lead to malabsorption, maldigestion, and protein loss. And endotoxins cause an increase of fluid secretion, and a high increase of intestinal peristalsis means there's not enough absorption. The acute consequences of diarrhea are dehydration, metabolic acidosis, and uremia, and they're also susceptible to secondary infections. The chronic consequences of diarrhea are maldigestion, malabsorption, decreased protein and vitamins, which leads to a negative energy balance, and edema and cachexia. The signs of peracute diarrhea is death without diarrhea. This can happen in the case of Clostridium perfringens D. So when you give a high amount of food at once, it causes bacterial overgrowth. Signs of acute diarrhea is fever, dehydration, cosmal breathing, which happens in the case of metabolic acidosis, as well as dry skin and cold extremities. The animal can also have a small rumen and bubbling intestinal sounds. In chronic diarrhea, they can get paratuberculosis. Diarrhea in the case of dehydration is very thick. In the case of salmonella, it's bloody. In the case of an ulcer, there's melena. In the case of Cryptosporidium parasites, it's yellowish. In the case of left displaced abomasum, it's well digested. And in the case of traumatic reticuloperitonitis, it's not well digested. For the diagnosis, look at the signs and see if there's any epidemiology spread, and also do lab tests. For the treatment, eliminate the cause and use drugs against the infection. So in the case of a 60 kilogram calf, give 2 liters. In the case of a 100 kilo yearling, give 5 liters. And in the case of a 600 kilogram cow, give 30 liters. The general rule is 30 milliliters per kg. You can also give sodium bicarbonate to correct the acidosis, and in the diet give hay, bran and rumen juice. You can also give charcoal and calcium gluconate to help. In the case of paratuberculosis, also known as John's disease, this is caused by Mycobacterium avium paratuberculosis. It can occur in cattle between the ages of 3 and 5 years old, sheep and goats. For the signs, you'll see chronic weight loss, beard edema due to the dehydration and skin edema, and watery yellowish greenish diarrhea, as seen here. In the pathology, you'll see brain-like surfaces of the intestine, as seen here. And for the diagnosis, you can do Zeal-Nielsen as well as PCR. For prevention, follow epidemiological rules and eradication